Thank you for joining us today for an update on COVID-19 and how Clackamas, Multnomah, and Washington counties are responding to the surge in cases. Joining us today is Multnomah County Health Officer, Dr. Jennifer Vines, Clackamas County Health Officer, Dr. Sarah Present, and Washington County Health Officer, Dr. Christina Baumann. Following their remarks today, we will open it up for your questions. And with that, Dr. Vines, we'll turn it over to you.
Thank you, and good afternoon, everybody. Thanks for being here. I'm Dr. Jennifer Vines. I'm the Multnomah County Health Officer. I'm really pleased to be here with my regional counterparts, Dr. Christina Baumann from Washington County, Dr. Sarah Present from Clackamas County, to paint a picture of what we think the next several weeks are going to look like as Omicron continues to spread in our communities. So it is a new year. We are dealing with a new strain of COVID that behaves very differently from past strains of COVID. And so I want to just talk a little bit about the Omicron variant itself. This is a COVID virus that has many changes to it that makes it very good at passing quickly and easily from one person to another. It's very good at getting into our throats and staying there. It's also very good at getting around some of the initial protections that those of us who are vaccinated have. But the good news is it doesn't appear to get around the other immune defenses that we have from vaccination that keep us from getting really sick. So you're going to hear us emphasizing a lot today the importance of vaccine, especially boosters for people who are over age 50 and have underlying medical conditions who are high risk of having complications from COVID. But we want to emphasize also that every dose of vaccine counts. So any chance to give your body a look at what the virus looks like and a chance to prepare is good for you, and it's good for the community. Numbers have doubled week over week in all three of our counties for the last couple of weeks as we see Omicron essentially becoming the majority of the virus in our region and in our state. We expect that to continue. Unfortunately, after several weeks of hospitals slowly going down after the Delta surge, we're just starting to see or hear about an uptick in hospitalizations of people. We can't say if those are Omicron related or still Delta. It's impossible to say exactly, but it is cause for concern given that our hospitals and health systems are already under intense strain. And by that, I mean EMS calls are up 40% over a usual average volume, and at least one Portland Metro emergency department, a large emergency department, was physically out of space at one point yesterday afternoon. So we're here today to share some difficult news. We're also here today to make sure people are informed and that they know how to protect themselves, how to protect their loved ones, and how we're all going to get through these next few weeks. So I want to just talk briefly about what I think all of us are going to feel these next few weeks, and then what most of us might experience, and then what some of us are going to experience. So I suspect all of us are going to feel the squeeze of Omicron spreading quickly through our communities and people calling out sick. That's going to disrupt services. It's going to disrupt hospitals, childcare, businesses, public services as people stay home when they're sick, which is the right thing to do. But it means that we're all going to feel, excuse me, it means we're all going to feel some strain around just the wave of illness that's going to pass through the community and effects on services that we're going to feel. Most of us, I think, are going to encounter Omicron, and most of us will have mild or no symptoms from Omicron. So those of us who are younger, who have protection from vaccine, especially if we're boosted, excuse me, are going to be more likely to have either no symptoms or to have mild symptoms like a cold, recover at home with no problem. Some of us, relatively few of us, may get severe disease from Omicron. And the way the virus spreads so quickly means that it can very easily find the people who are going to be most at risk for severe disease. And because it's going to spread quickly, those who end up needing hospital level care might be relatively small in number, but they're likely to all need care at the same time. And so when we hear about OHSU modeling forecasts showing a high number of people needing hospitalization by the end of this month, those are the unlucky and the high risk who are going to need hospital level care at right around the same time, which is going to really strain our hospitals. So you're going to hear us talking a lot about, again, the importance of vaccine to avoid being in that relatively small group of people who are going to need hospitalization. You're going to hear us emphasizing masks and well-fitted masks in particular. So making sure your mask covers your nose and mouth and leaves no gaps around your face. And then also limiting contact. So choosing to limit the number of people that you interact with is going to lower your chances of encountering the Omicron virus. But I don't think we can get to zero chance of Omicron in any human gathering. I don't think that's realistic based on the way this virus behaves and what we're seeing in other countries. So with that, I'm going to turn it over to Dr. Present to share more about how we're adapting our local public health response. And go ahead, Sarah.
Thank you, Dr. Vines. Again, I'm Dr. Sarah Present, Clackamas County Health Officer. I'm going to talk a little bit about the public health response and our shifts. So as we said, a new year and a new variant, and some of the old rules really do not apply before Omicron. We want to be clear to the public that waiting for a call from public health is not going to slow the spread of Omicron. Omicron spreads much faster than 2021 versions of COVID. Many people who are not infectious may not be showing symptoms. Many people who are infectious may not be showing symptoms. Testing is extremely hard to come by at this moment. And many people are using home tests, which are not reported to public health in the majority of the time. With all of these challenges, people can spread Omicron far and wide before public health is ever going to know. So in reality, our processes of case investigation and contact tracing that we've been hearing about for the last 2 years for each positive test is kind of like bringing a snow shovel to a tornado. It's a really great tool, but it's just not the right tool for Omicron. So people who are positive for COVID at this time should expect that they have Omicron, and they should not expect to hear directly from public health. We are all shifting our staffing and our resources to being able to answer questions, to focus on outbreaks in high-risk settings, such as long-term care facilities, and to making information available on how each of our counties can link you to wraparound services that you may need if you need help to isolate when you're sick. We are also pivoting staff and resources to protect more people from severe illness through vaccination. Vaccines and boosters are well established at this time to be the best and safest prevention against illness from Omicron, and all 3 counties are increasing our vaccination efforts so that vaccines can be more available for all, and focusing on getting vaccine boosters to those vulnerable communities that need that extra support from us. Finally, we are working to help with access to scarce resources such as testing. So as I mentioned, testing is extremely hard to come by. Most people are aware of that at this point. It's hard to find in the stores. It's hard to find at the doctor's offices. Public health does distribute at-home test kits through community-based organizations to help those who are most vulnerable. So right now we don't have a supply for the general public. Still, I ask you, please do not use our emergency rooms if a test is all that you need at this time and you're not seeking emergency medical care for severe illness or injury. And with that, I will pass it over to Dr. Bauman, who can give you some more information on what to do if you're feeling ill. Thanks.
Thank you, Dr. President. Hello, everyone. I'm Christina Bauman, Health Officer for Washington County. As you heard, many of us with Omicron may experience just mild illness, but some of us are at higher risk for severe disease. And right now, if you have risk factors for severe disease from COVID-19, this is the time to take some extra precautions and ask those that are around you to do the same. This includes getting up to date on booster vaccines, wearing a good mask, and limiting unnecessary gatherings. Since the end of December, our case count in Washington County has almost quadrupled. That means that many of us have Omicron or will soon get it. So everyone should know what to do if they get sick. Testing supplies are limited. You may not be able to confirm what you have with a timely test. If you become sick or with or without a positive test, assume you have COVID-19 because that's what's circulating in high amounts. Take steps to protect those around you. Some of these include isolating away from others for at least 5 days, per the CDC guidance, staying in a separate room and using a separate bathroom if possible. Take care of yourself, stay hydrated, rest, and over-the-counter medications may relieve some of your symptoms. Call your provider for advice if you are at high risk for severe disease, and make a plan for if your symptoms get worse. Wear a good mask everywhere, including among household members, for the full 10 days. If you can, avoid contact with people who are at risk for severe disease for the full 10 days. You may have heard about treatments for COVID-19 like monoclonal antibodies and the new antiviral pills. Unfortunately, these are really limited in supply, especially since some monoclonal antibody treatments are less effective against Omicron. They are available to some people who are at high risk through our health systems, but most people who get the virus won't have access to these medications for now. Vaccines are still our best and most available tool to prevent severe disease. Get up to date and boosted. Each of our counties has a website with opportunities close to home. You can also go to getvaccinated.oregon.gov to find sites.
So as we mentioned, we do have resources available to residents. You can dial 211 or visit their website at 211info.org or text them at 898-211. Counties also have resources available and can help you with questions that are related to your specific county or help you with resources. You can call the counties directly, and you can also visit our websites. And with that, we will go ahead and open it up for questions. Please use the raise your hand feature and let us know who your question is directed to and your news organization. And we will start with Amy Green. Amy Green, if you could please unmute yourself.
Hi, can you guys all hear me now?
Yes.
Okay, great, thank you. Okay, a few questions. I see that some of the highest rates of spread of COVID right now, kind of a surprise, kind of not, are in Portland, in the really core neighborhoods of Portland and the center of Portland. And I also see that Lake Oswego is experiencing very high rates of COVID spread, which is different than before because these neighborhoods, these areas have very high vaccination rates. And I'm wondering if you can speak to that. Is that what you're also seeing, and why? I mean, is it breakthrough cases? And also, why is it because these areas are very dense, that there's public transportation, there's lots of restaurants and activities to go to? Can you talk about that?
Yeah, thanks, Amy. I can take that question. It raises first an important point about the test results and the case counts that public health can see, which are those that get reported from labs and health systems that report to us electronically and get logged as cases and show up in your maps. It's really important to note that with self-tests becoming more and more common, it's a good thing in terms of getting a convenient, quick test into people's hands. There's also no way for public health to take those reports. So we don't have visibility on test results that people are doing at home, and that's going to make up a larger and larger share of the testing. So just that caveat. My educated guess response to the phenomenons that you're describing, I think probably have to do with health behavior. So people who are vaccinated and who are concerned about COVID enough to get vaccinated are probably also able to access testing. And so those are the test results that were showing up. It's no surprise that we're seeing cases in people who have had vaccine, which is to say the first 2 doses of Moderna and Pfizer or a single Johnson & Johnson. I know that in Multnomah County for the week of December 19th, a majority of our cases were actually breakthrough. And so in a county with as much vaccine uptake as we have had, that's not a surprise to me. So I suspect I'd have to dig more, but I suspect it has to do with health behavior and access to both vaccine and testing.
Dr. Vines, can you say what percentage in Multnomah County were breakthrough cases and over what period?
Let me get back to you on that to get you the right number. I'm going off what I roughly remember.
Thank you, Amy.
I have one other follow-up question. I'm also wondering if what you would say to, I'm hearing a lot of people saying that, oh gosh, like I'm fully vaccinated or have a booster, and it seems like inevitable that I'm going to get sick. So I'm just going to go out and do my thing and live my life. Is it what would you say to that? I mean, it's not inevitable. Like what would you say to these people?
I will take that one, Dr. Vines, but help me out if I don't say enough. I think we have a large amount of spread of Omicron right now. There's a good chance that you would be exposed to Omicron in the next month if you are going out and about your normal activity. I think there is still a really fantastic opportunity right now to limit spread and protect our hospital systems. If you are vaccinated and boosted, the chance of you becoming severely ill is very small, but you can still spread it. You can still require others or yourself to have to miss time away from work or school. And so we have an opportunity for the next month or two as this Omicron surge goes through to continue our behaviors to decrease spread as best we can. But thank you for getting vaccinated and boosted, because your chance of getting severely ill and needing to be hospitalized or have emergency care is significantly decreased.
Just last follow-up on that though, do you think it's possible to go out and not get sick from Omicron? Can I go to a restaurant and not get sick? Can I go to my workplace? Can I ride the bus?
Yeah, I think people who are going out and about their lives over the next few weeks as Omicron becomes dominant, I think they have to assume that they're going to encounter the virus in some setting, whether it's at work or in their social circles or in other activities that they do with any other people. I think people are going to be best prepared for that encounter by being fully up to date on the eligible vaccines. Wearing a mask might lower their chances that much more of getting an infection. And then finally, I have to believe that none of us wants to be the person who infects someone who is high risk. So again, taking those precautions in particular around people who are high risk is going to be important as we navigate these next few weeks.
Thank you. Moving on, we'll take Amelia Templeton, please. Amelia, please unmute yourself.
Yeah, hi, can you hear me?
Yes.
2 questions, one very brief. Which Portland area emergency department ran out of physical space?
So that it is a true example. Let me work with that facility to follow up with your question rather than speaking for them.
Okay. And second, you know, I ask not to call out any individual hospital because it's clearly a systemic problem, but just to be able to report with specificity and accuracy. Second question, so the 3 counties are no longer doing individual contact tracing of cases. When you do get notified, are you still being notified of positive PCR results automatically? And then what should people expect if they get a PCR test? Should they expect that they're going to get a text? Should they expect no communication? What does that look like now if you test positive?
So right now, the tests that are being performed through the health system, you'll of course have your contact from your health system, the testing provider to really receive your test results and education. Public health is not going to be directly outreaching to every positive case that we hear about. That's why we're shifting and trying to make sure that we have a lot of good information on our websites and through our various modes of communication so people know what to do when they've tested positive or if they are exhibiting symptoms of COVID-19 so that they can take precautions for their own health and to protect those around them.
Thank you. Moving on, Kelly Azar, you're up next.
Sorry, can you guys hear me now?
Yes.
Okay. So I have a kind of a 2-part question, so bear with me. The first one, I hate to be the one to ask, but I know there's a lot of people wondering is, should we be, rolling back some of our openings? Should we be putting some of those precautions back into place, like no indoor dining and things like that? And then I'll ask my follow-up after that.
Kelly, I can take a stab at this question. I mean, this is really one for our policymakers. I think restrictions have played a role in the COVID pandemic, an important role in the past. I think as soon as the federal government and the state signaled that that type of approach was off the table, it essentially took it off the table for counties, because acting as a single jurisdiction or even as a region, it's hard to get the same effect. And it's a very, very blunt tool for slowing spread. So I think the effectiveness and the burdens on businesses made it pretty unappealing for this particular point in the pandemic.
Okay, and then my follow-up question, I apologize, Dr. President, if you want to respond as well, please go for it.
No, I did want to actually comment on this a little bit as well. I would not anticipate any mandates to limit gathering sizes or close any particular venue or business, but I am encouraging those who have events planned to consider the current state of COVID, consider postponing or moving to online if that's possible. It won't be a mandate, but it's important for everybody to understand where we are with this and take the precautions that you can take to safely and effectively run the businesses that you need to run.
Thank you. And then my follow-up question, it touches on these on restrictions and things like that, but also on the fact that, as you guys mentioned, an emergency department ran out of space. Particularly, we've been hearing from, first responders, and you guys have said this, all of doctors that we've spoken with have said this, that this is going to impact employment, people being able to show up for work on a day-to-day basis. No doubt that also means our EMTs, our firefighters, our police officers, without there being restrictions and with this spread being as big as it's seemingly going to be, should we be concerned that, our first responders can't do their jobs? And what would you say to that?
I'll take your question, Kelly, and then I'll invite my colleagues to add as well. I think I want to thank everyone who's on the first line of public safety and the services that just keep our lives running, that sometimes we take for granted. I want to be clear that for most people, this is going to be a mild illness. We see that Centers for Disease Control is actually shortening isolation and quarantine times with an acknowledgement that that continuity of operations piece has its own life safety goal. And so some frontline workers will be candidates for even shorter isolation and quarantine periods if it means continuing a critical life safety function. I don't know that we're at that point yet, but the revised guidance from Centers for Disease Control that Oregon Health Authority is also adopting is a signal that may be needed as long as someone is well enough to work and able to take additional precautions like wearing a really good mask.
Thank you.
We'll just take a few more remaining hands. Isabella Garcia, you're up next. You could please unmute yourself. Thank you.
Thank you. Just as you're saying that case counts are becoming a less complete picture with the rise of at-home tests, I'm wondering what metrics or combination of metrics should we be looking to most accurately grasp the status of the pandemic in our communities?
I think that's a good question and brings up a really good point, that our data is going to be incomplete. The nature of the testing environment with so many home tests, not being able to capture all of those numbers, we are not going to have the perfect picture from the numbers that we do receive and that we can put on our dashboards and communicate outwards. So I think the big takeaway is to look at those numbers with that understanding and also know that they are going to be an undercount moving forward, especially if people aren't able to get a test or are performing home tests.
So are hospitalizations a better, metric of how the severity of the pandemic at this point?
Thank you. My name is Kim Repp. I'm the Chief Epidemiologist for Washington County. And as Dr. Bauman has said, we know that the information that we have, the data that we have, are a significant undercount of the actual positive tests that are out there. As an epidemiologist, what we are watching, as all our wonderful health officers have said, is our hospital capacity, because that's a really big red flag for our system that it's under significant stress. So we will be relying on hospitals, as they always have, to report to us how many hospital beds are left, what is their capacity. We are going to be watching our deaths very closely, and we will still be looking at our case counts, because again, if they're going up exponentially, that's still a big problem. So we'll be looking at a bunch of different metrics to keep the pulse check on what's going on in our communities.
Thank you.
Next, we'll turn it over to Rachel Monahan.
If you can hear me, I am interested in your advice and who you're giving, who at this point is high risk. I mean, as far as I understood it, about 40% of the state qualified as having an extra risk of getting COVID when vaccine eligibility was on the table. Are we talking about that percentage of the population that you're saying needs to take extra precautions right now? And like, is your advice, if you're 65 or older, don't go to a public place if you can avoid it, even if you're masked? Like, what I'm really confused what your advice is for those folks and anyone who is like potentially in their household or otherwise able to spread COVID to these folks. Like, is it just like, you know, the immune compromised who're taking immune suppressants, or is it, you know, somebody with high blood pressure or is overweight?
Yeah, thank you, Rachel. We are still getting a better picture of how Omicron is going to interact with the risk factors that we've known for some time. Looking back at the most recent data on who is most at risk, we absolutely know that being unvaccinated is a real risk for severe disease. Looking at people that have gotten the primary series of vaccine or have gotten booster, what we're looking at is how many risk factors you have. The more risk factors that you have, that moves you further along the spectrum of being at risk for severe illness and outcomes. So risk factors include age, absolutely, over the age of 50. Chronic diseases such as heart disease, lung disease, kidney disease, liver disease, diabetes. All of those are conditions that can increase your risk. And if you have more than one, will increase your risk further. And certainly immunosuppression impacts the ability of your body to develop a good response with vaccine and to fight off the COVID virus. So each of us has a different combination of those risk factors, and we all need to take stock of the risks that we have and make decisions based on them as we move through this time.
I guess I get that the picture is a little unclear. So what I'm hearing is we don't really know the extent to which, you know, if you've even gotten boosted, you are protected if you have multiple, you know, risk factors. But what is your advice to somebody who has more than one risk factor, if that's what you're really looking at as, you know, potentially the big issue? Say I've gotten boosted and I'm over 50 and I have another condition. What's your advice to me and anyone who comes into contact with me?
Sure, thank you. So you highlighted the most important things to do, which is to get the vaccine and to be up to date on your booster. From there, other things that could be protective during this time are limiting the number of contacts that you have, not going to unnecessary gatherings, and wearing as good of a mask as you can that's comfortable for you to wear regularly. All of those things are really good ways to further reduce the chances of you encountering the virus.
Why aren't you recommending N95s to everyone at this point?
Sure. Well, the reality of N95s are that they work best if they're fit tested, which not everyone can do. In addition, they can be very uncomfortable to wear for a long time. And they are included among disposable masks. So you need to have a supply of them to turn over. So really, if you're looking at wearing a mask for a long time, you'd probably turn to one that's available to you and also that is comfortable, but also consider the other factors that make a mask more effective, which is the fit, and try to optimize that fit and the number of layers of filtration.
Thank you for that. That's all the time we have for today. If you have questions that were not answered, please feel free to drop us an email. And again, we have information available about COVID-19 on our websites and resources available for community members. So thank you again for joining us today.